Thank you to Big Sky Economic Development for supporting The Vault at 201 North Broadway.
Big Sky Economic Development is the community's economic development organization. BSED's mission is to sustain and grow our region's vibrant economy and outstanding quality of life by providing leadership and resources for business creation, expansion, retention, new business recruitment, workforce development, and community development. Learn more and connect with BSED at bigskyeconomicdevelopment.org. Welcome to our Vault Shorts. These are shorter episodes highlighting programs and resources here in our Billings community. Today, we are joined by Katie Meier, the State Director for HOSA, Future Healthcare Professionals of Montana.
The following is a Big Sky Economic Development production.
It's Mars B.
And Kavo.
And this is The Vault at 201 North Broadway,
A business podcast
where we bring you entrepreneurs, small business owners, and community leaders of Montana.
You don't want to miss this.
Learn how to better start, manage, and grow your business.
And your leadership style.
Tangible takeaways to save you time and improve whatever it is that you're working on.
You're listening to The Vault.
Welcome.
Thank you.
We're excited to have you. I think I didn't screw that up. The future
health professionals. Yeah.
Yeah. Okay, good. So I didn't. So
remind me to tell my fun story about HOSA.
Oh, you really did it.
Huh?
Did you do it?
No. But you had me come help people network.
Oh, yes, we did.
I'll tell later in the episode.
We'll talk about it later. But yeah. Katie, we know you wear lots of hats. So do you just want to tell us a little bit about you and what led you to that role and then the other role that you have that we'll let you talk about?
Yeah, sure. So I'm still a full-time classroom teacher here in Billings. I'm in my 9th year teaching in Billings over at the Career Center in our medical science pathway. So we do a lot of, medical prep, career exploration with that program. And so kind of in that realm, I got involved with HOSA Future Health Professionals when I first started teaching as a advisor. So HOSA is kind of like FFA, which more people are familiar with, or BPA, but we're for healthcare oriented. So we're 100% healthcare oriented, and it helps really tie kind of what we're doing in the classroom to kind of real life application for students. So we say that it's co-curricular. So it's kind of a club, but we really integrate it into the curriculum of what we're teaching for students to gain more exploration, be able to kind of dive deeper into things. And so our state director, we kind of lost her to another state during kind of that COVID pandemic, and I stepped in kind of, I guess, more intentionally, not this long, but I've really kind of taken off with that role and really enjoy being able to kind of help other advisors across the state and teachers provide those resources to their students.
So let's dive into that. What is that like? What are those things? Is it clinical and administrative? Is it all types of healthcare? Or is it more focused on the hospital, vet?
Yeah, it's kind of all over in healthcare, and we let students explore. So we have, I can't think off the top of my head, over 76 industry recognized competitive events that students can participate in.
Wow, that's a lot.
Some are kind of test only, so they can kind of explore that career and take a written test. Some are soft skill oriented. So we have things like a medical innovations competition, kind of like a Shark Tank, where they invent something and come up with a prototype of something that they think would help the medical industry in some way, and they can present on that. Job interviewing skills, a lot of community awareness type projects where they're in the community teaching health education projects, and public health initiatives, public safety initiatives. And then they can also compete in more technical skills, things like EMT, CNA. We do dental, we do vet science. And so we don't have a lot of administrative type kind of non-clinical space, but I think we get those in those soft skills where they still get a chance to develop those public speaking skills, those networking skills, their communication. So even though it's not a direct line into something like healthcare administration or non-clinical, they're still developing those soft skills that are so valuable.
So is it because I did FCCLA, which I'm sure it's not called that anymore. I feel like we talked that it's called something different, but it's still used that. Anyways, I could sing our Montana song and do all of that, but I'll save that for a later date. That I wouldn't sing on mic, but that would be embarrassing. So what is the role of the school and the teacher? because it seems like a really big lift that you have. So you are doing classrooms, you're working with our local hospitals that I know because we've worked together a lot over the years. But what is that role for a school? Like if they don't have it, or like what's that expectation?
Yeah, so if a school wanted to get started, or if they had a teacher that was doing this role, as the state director, we kind of give them some parameters and some ideas and support of, hey, I maybe live in this more rural community. We can't do, what Katie Meier can do in Billings with the big hospitals and the hospital corridor, but we have a huge need for healthcare professionals in these rural areas. And how do we get our students excited? And so we really try to let them tailor it to what works for their community. So in some, it could be co-curricular, and maybe they start a CNA class or an EMT class, and they kind of weave the club within that. But we know a lot of those small schools don't have, I guess in the teaching world, we call it FTE, like enough teachers to do that. And so it might end up being more extracurricular. And so we'll kind of try to help partner them with other community partners that can help support them. So let's say they're a science teacher and they're like, I don't know how to help this kid with CNA. We try to reach out to those critical access hospitals or the area health education centers and say, hey, what can you bring to these kids in this community as far as learning these healthcare skills? We've been trying to partner with a lot of colleges to bring in some dual credit or online type CNA programs so that they can get those skills when they might not be able to do it in their classroom, and just let those kids start exploring as early as possible and see what fits.
And so what are the ages of the students that are, is it like freshman through senior, or is it more like upper level junior, seniors?
Yeah, in Montana, we're high school based. Some other states have gone into middle school. We've done a little bit of middle school on and off in Montana. But right now we're primarily high school based. But again, nationally, they're middle school through college, actually.
Wow.
So
I think that's for FFA too. They're in college. I feel like Bozeman leans into that heavily, if I'm not mistaken. But anyway,
probably.
Yeah. Like at this, yeah.
Well, can you explain a little bit more about like the different services that HOSA offers to these students that are interested in, pursuing a career in healthcare?
Yeah, so at the local level, it kind of depends on their need in their community, what the students are interested in. And so we try to ask them, at a minimum to kind of have this framework where the students are getting some kind of leadership activity, some kind of professional development and career exploration. But at the state level, we try to provide kind of some of those bigger things. So we provide free of cost a fall leadership conference in Butte every year. So we help reimburse cost of travel, and then they can bring their state officer team and get ideas of how to build that framework in their community of what's doable for community service projects and career exploration. We provide kind of some video tutorials for a lot of the skills online. We have kind of how to do the CNA skills, how to do the EMT skills, phlebotomy. So if they don't know how to do that or don't have someone in their community who can teach them, we have a big video resource library and skill sheets, and then, provide resources throughout the year. But our big event is our spring conference. We have a state leadership conference in April every year. We've been doing it here in Billings just because we have such great partners here who are all hands on deck helping us with it. But it's a 2-day conference, and the kids can compete in those things. But we also have learning symposiums and workshops where industry professionals come in and do hands-on skills with the kids in different variety of healthcare things. We have kind of a tabling event with lots of hands-on stuff, and like Rocky Vista gets out there all their cool simulation equipment, and the kids can play with ultrasound and see all these different views. And we're able to get them on 3 college campuses, which I think is really unique. So they get to see a 2-year campus, the medical school at Rocky Vista. So they're at City College, Rocky Vista, and then at Rocky Mountain. So they're getting to see some public, some private, 2-year, 4-year, and just kind of see themselves there. I think getting kids onto a college campus that maybe haven't been before and seeing the different ways it is, they can, have that belief in themselves and see themselves there.
And I love that, like Rocky, an alum, so I'm just going to give a Rocky plug, but they have like the pre-med track, the OT, PA programs. And I think for students to be able to see, like, I can get really quality education in Billings at MSUB, City College, Rocky, and then it could be a feeder into going to RVU, MCOM.
Definitely, yeah.
Well, I love that you give opportunities for them to test out different specialties, Because, I think going into that, I just generally think, oh, you just kind of do it all. But no, there's like different segments of that. And that kind of gives them a taste of, what direction do I really want to go into?
Well, and so many of them they don't know what they don't know, right?
Yeah.
They come into these programs and what do you want to be? And it's doctor, nurse. And they don't know anything about respiratory therapy or occupational therapy or even just starting to get clinical hours at maybe some of these entry-level positions. And what does that entail, and how does my journey, kind of weave? They're going to do a handful of things before they get to their ultimate goal. And so getting to kind of see all the different options out there, I think is really cool.
And they'll probably value, I think this is just a perception, but I think you value things a lot more when you've done all of those like entry-level CNA work and all of those other things. And then you're now like the doctor, the nurse, you'll value those people that are doing those like foundational things for you because you did it.
Oh, definitely. And they gain so many skills, right? Not only the hands-on skills, but again, how to talk to patients and patients' families and decision-making and, and just kind of keep building themselves as they go through the process.
So do you have some students that stick out to you over the past few years that have really leaned into like all that HOSA has to offer and that have like really excelled in their pathway and next steps after they've graduated high school?
Yeah, it was kind of cool. We did a brochure a few years ago where we kind of captured alumni stories of how did HOSA help get them where they're at. Yeah. And we tried to kind of chronicle students all the way who've, gone into like med school to students who've done 2-year programs and students who've done entry-level type work and how HOSA helped, prepare that critical thinking, that ability to perform under pressure, the networking and the people that they've met. I think one of the things my students really value is just the community that's behind them. I think that's, Billings has been awesome to us here locally in the medical community, and they see that investment in them and they want to give that back. And so I think being part of HOSA and all the people who help them in their journey of where they've been, they want to give back to that. And so I think that's been one of the cool things to see is how many of our alumni come back and want to volunteer within our program, whether it's the HOSA or the classroom. It's just really unique.
That's really cool.
The impact, you can actually like see the impact, right? And you're like, I've done something.
Yeah.
So tell us a little bit about I know we are here talking about HOSA, but because you are a teacher at the Career Center, what are some of those classes like for you? Because I know they're very hands-on and you're getting them really great experience within the medical corridor.
Yeah. So our students can start in our medical pathways at the Career Center as freshmen. And so we have a whole variety of kind of introductory anatomy type classes to things that are more specific, like an intro to the OR class, medical terminology, as they kind of move through. I teach seniors only in my program, and so they're kind of capstone classes. I have the medical careers class, which is a huge community partnership. It's a 2-hour block where they do some anatomy, but then every Tuesday they're out in the community job shadowing.
Oh, wow.
And they're in pairs, and so they're really getting in there. They're in a surgery, they're in the NICU, they're in, speech therapy, or they're in dental, and they're really getting to kind of see that every week and kind of navigate what fits, what doesn't fit as they're kind of trying to find their career path. And we do a lot of kind of college prep and planning to get into those programs and how competitive they are. And they find a lot of our alumni in the field. I've kind of started going broke because I originally started this program called Alumni in the Wild. And if they find one of the alumni that I taught that's working at the hospital when they're there and they get a picture, I would like owe them like a coffee or a treat. And we have so many working now that every week I think they're finding 2 or 3. And so I'm going to need like another side job just to kind of keep up with
here, I made
your alumni to start, helping.
Yes, yes.
Be like alumni in the wild.
Yes.
Wild, yeah. And you buy them a coffee from the hospital.
Yeah, and I think it's cool for my kids to see them and know that it's possible. This person so recently did this, and they kind of share their story of how this class or how HOSA helped them get there. And then the other one I work with is our EMT program with City College. We do a dual credit. We work a lot with like Big Sky EMS and the fire department. And so both those classes, just so many community partnerships that my students get to really meet people in the field and get a firsthand perspective of it.
Now, are there like scholarships that they get through HOSA or does it open them up? Or I know you mentioned that you guys kind of help them get prepped for college. So what does that all look like?
Yeah, so not a lot of financial benefit right into the student's pocket, but obviously access to a lot of those programs and things like that. And then all the career and technical student organizations, so the acronym in the education world is CTSO, so like FFA and BPA, received additional legislative funding in the last session. And so we're hoping to spend that money kind of more directly in the local chapters, paying for things like bringing in, CNA where they didn't have CNA before, or these dual credit things, to get kids these early licensures to get in the field for their sake, but also our community's sake. There's such a shortage of healthcare workers, especially again in some of these rural areas. And so if we can get these kids filling some of that gap, it's like a win-win-win.
So how many students or schools would you say like statewide? We'll start schools or counties.
Yeah, so we've been growing. We've added a handful of new chapters this year. So I think we're getting close to about 30 new schools.
That's great.
But we've been doing some new things with that because some of these rural areas can't find a teacher or don't have these huge numbers. We've been kind of doing more co-ops. And so we've been looking like at Eastern Montana, of partnering with the Area Health Education Center and the Montana Healthcare Network of kind of like these virtual kind of co-ops to try to really tap into these areas that just are kind of underserved. So we're trying to hit some more of these rural areas, more of our tribal communities, and think outside the box of like what a traditional school chapter might look like.
So how often, like your Billings chapter, is that like for those interested, maybe they're parents listening or students listening, hopeful that a high school student would be, but what does it look like? Is it based per school? So like Senior, West, Skyview, Careers, like what does that look like?
So in Billings, we only have the chapter for the public schools at the Career Center. So kids in any of those public schools in town can come out to our chapter. We meet monthly just because, again, of that travel time with the 3 schools and those challenges. Billings Central has a chapter. They've been growing exponentially. I think they meet more regularly just because they have some of that club time and the kids are all in the same building. And so every chapter kind of runs it what best fits them. We kind of don't set those parameters, but kind of some will meet at lunch or they have club time built into the school day. So kind of whatever works. But yeah, locally in Billings, if they're interested, they can kind of get a hold of us out at the Career Center.
What are some expectations on the student as they're getting involved?
And again, so each advisor is kind of probably going to set that for their kind of school as far as, you're going to put this on your resume, you're going to use this. How involved do you have to be to claim that you're a HOSA member? Do you just pay dues and that's it? Or how involved are you? So I ask my kids to be involved not only in our monthly meetings, but that they go out and get 10 HOSA hours is what I call it. So every month we try to have learning opportunities, volunteer opportunities, projects that they're doing, and they have to sign up to what interests them. So some, want to work with kids. And so 2 weeks ago, we partnered with the Quest program in the elementaries, and they went and taught about the brain. So I had 20 kids, 4 went each day and went and did hour-long presentations about the brain to kids. And my students who love working with little ones and maybe are interested in peds went and did that. My students who don't enjoy working with that age group, maybe I'll do something at the nursing home next month or volunteer to be patients with, Big Sky EMS when they're doing their EMT testing. And so just trying to provide lots of different things that they can choose. And so I ask them to get 10 hours if they want to be considered active, put it on their resume, come to the state conference type of thing.
Which I think is so fair. Like if you're going to be listed
10
on your
hours
resume,
is not that much.
like you better be involved kind of. Yeah.
Yeah. And so it's pretty easy for them to get and trying to recognize that I never want to rule a student out that's busy. I have a lot of kids who might work 40 hours a week or they're taking care of their siblings, they're in sports. And so, I'm a little more open maybe than some of the other advisors of you're going to get into it, what you put into it. So here's kind of the minimums and lots will get, 50, hours of doing stuff.
Wow. So is it every year they like enroll and just thinking of the school year, is it just meeting during the school year? Are they doing anything in the summer?
Mostly school year, although like my carryover of kids that are returning, again, just our community partners will reach out and say, hey, do you have any kids that are interested in this? We're doing this summer. Do you have any volunteers or do you have kids that are interested? And so we, as I have access to them, keep plugging those opportunities.
And so you teach an EMS, right, class?
Yep.
So how early can people be an EMT? Like at what age?
So you're asking me kind of a tricky question that we were meaning to look into recently. Nationally, they can sit for their national licensure, I believe it's 16.
Okay, because that's a hard test if I'm not mistaken.
Yeah, very hard.
Like really hard.
Yeah, but traditionally in Montana, you had to be 18 to get your Montana certification.
Got it.
So we teach it as a senior-only class, but I'd seen somebody advertising another class recently that was taking 16-year-olds. So I don't know if the Montana law changed. And so it was something I was going to research because I'd sat in on a few calls where people were debating what is the appropriate age for kids to get into this industry, because in EMS you're seeing it
a
all,
lot,
and
yeah.
you're seeing a lot of heavy stuff. And,
Yeah.
you know, even for my students on their ride-alongs with the fire department, you know, we do a lot of prep for the types of things that they're going to see, and what are some of the coping skills with
how do you
that
process
and that processing. And so, you know, I think there are some kids who could do it at 16 for sure, but I think it takes the right mentorship. And, you know, do you let a 16-year-old run a call with another 16-year-old, you know, at that age?
Know.
And I know some of those rural communities kind of need that. There's just not anybody answering those calls. And so I know there was some debate about changing that age and a lot of, you know, back and forth on the pros and cons, but traditionally it's been 18 in the state of Montana.
Yeah, I was just wondering because I'm like thinking of like growing up in Ekalaka, and they're having a ton of troubles just getting people to keep, you know, like your population, and then it's just less and less, and the people that have been doing it for years and years are just aging. So
yeah, and some of that civic mindedness I think has changed.
Yeah, I would agree with
kind
that.
of being involved in that community. And you know, that's one of the things we talked to the kids a lot about, and the kids in the EMT class really see that and want to fill that void and fill that call, which is really cool.
Mm-hmm. So Katie, where can people go to learn more about HOSA?
Yeah,
and tell us what HOSA stands, like if people are listening, because
Say it again,
I was confused because it's like an acronym, HOSA, HOSA, but then there's a little brand change, right?
Yeah, so there's a rebranding. And so it used to stand for Health Occupations Students of America. We've gone international, so we're in quite a few different countries now as well. And so the of America doesn't fit. And so in that rebrand, it's now just HOSA, Future Health Professionals. Mm-hmm. And so it doesn't stand for anything anymore, which is always kind of difficult when you're trying to explain the organization. But yeah, there's a national website at HOSA.org, MontanaHOSA.org. Some of our socials that you can find us on if you search those.
So if someone's interested in like, they're like listening, maybe they're not a student, they're not a teacher, are there ways for them to volunteer
Definitely.
with the local state chapter?
Yeah, so people who are in the healthcare industry or even not, I think if you want to get this going in your community or support your students in your community, volunteering to be speakers or teaching skills are invaluable. Letting students job shadow, kind of going through that process. At the state level, our state conference, just a little plug, is April 1st and 2nd. So we're always looking for judges for those competitions. Some can be healthcare professionals, but some, like I said, listening to a Shark Tank pitch or listening to a job interview. It could be, you know, people that are just in the regular workforce that are willing to listen to students and you know, the time that they put into these projects and kind of honor that. We're always looking for that, as well as symposium presenters, sponsors, to try to get more scholarships into the students' hands. Lots of ways to get involved.
Yeah. Yeah. And who do they contact? Do they just contact you if they want to be involved?
Yeah, that'd be great. Yeah, you can find my contact information on our website at MontanaHOSA.org.
Awesome. Well, Katie, yeah.
Just one more question. You have so much passion for this. What is your favorite part about being a part of this? Because earlier you mentioned, I didn't expect to be in it this long.
Yeah, I think it's easy to see that return on investment, right? It's like, oh, I'm busy and there's so much going on, but just watching the impact that this has on the classroom and being able, as a teacher, I think if HOSA went away, I can't imagine it. It gives so much application to what we're doing in the classroom. It gives students that confidence to see themselves successful, that exploration, being able to support my fellow teachers. I think the past 5 years in the teaching industry has been really hard. We've seen a lot of burnout, a lot of people leaving the industry, and our group of teachers really support each other, and it's a kind of a family that really connects. And so I think being able to support my fellow teachers through the kind of these more difficult teaching years, and then watching the students come back and where they're at in life is just really fun.
Yeah, and they really keep connected with you. I feel like they like to keep you updated on what's going on. Yeah,
they do a great job keeping updated. We do an alumni coffee house every winter break, and they come back, and we invite the current students to kind of come meet with them and practice, again, networking skills and visiting about that journey. And so it's a great opportunity to keep in touch with them.
Which is such a fun thing you've cultivated for them. I mean, like, I didn't have that, and like, doesn't exist. So I think that's really cool.
Yeah, and it's fun. Like some that never went to class together have become, you know, friends and built this community of support for each other, and just from being alumni within the thing, it's fun.
Yeah. So is there anything we didn't ask you about HOSA that you're like, people should know this?
No, I just think that there's lots of ways to get involved, again, as a student or as a community member. And
maybe as a sponsor,
as a sponsor, we love that. Yes,
we love
yes.
money.
So lots of ways to get involved. And if you want more information, I'd love to visit.
Great. Thanks, Katie.
Thanks
thank
so
you guys.
much.
Appreciate you.
We hope you enjoyed this episode.
Make sure you are subscribed to The Vault at 201 North Broadway, wherever you podcast, including YouTube.
Connect with us on Facebook at The Vault at 201 North Broadway and Instagram at The Vault_201.
Don't forget to visit us at thevault@201.com and subscribe to our newsletter.
We will see you next time.
Bye. Big thanks to the Small Business Development Center for sponsoring The Vault at 201 North Broadway. The SBDC is an incredible resource for small business owners, offering free one-on-one counseling, business plan support, market research, financial projections, and much more. Whether you're just starting out or looking to grow, they're here to help your business succeed. Reach out to us at bigsky economicdevelopment.org.